Okay, so Erica is going to fill me on a quick YouTube that I'm going to be doing here today. I'm Annie Naylor with the Arizona Muscle Therapy Center, and we've just completed doing a myotherapy treatment on my client. And one of the things that we like to finish up with her is doing some sport taping. And I do use rock tape and I use kinesio tape. And you can see these YouTubes on my website at azmuscletherapy.com, and you can visit me also at Facebook. So what we're going to do here is we've gotten the neck and the shoulder area nice and relaxed, and so we want to set these shoulders. They help her for the next couple of days to really take a lot of the discomfort out of having any sort of neck or tightening back up of the muscles. So I'm going to start out with this taping, and this is really a great taping for anybody who's feeling like they're kind of rounding in their shoulders, or they're feeling that they're getting a lot of tension, headaches, and things of that nature. So we're going to start with 3 tapes in this taping, and my first tape is I'm going to take a pre-cut, and I'm actually going to cut the paper right off in the center. And I'm going to take that tape and I'm going to roll it out. And now I have it here. I'm going to put a little bit of a stretch on that tape. And I'm going to place it right up here in the thoracic area. And then I'm going to tamp that down. Now I'm going to take this one tape. And you want to try to keep your fingers off the tape. You want these tapes to stick, and they're very good at sticking, but you don't want your fingers really involved. So now I've got about a 50-60% stretch on that tape, and now I'm going to pull that off, and where I'm going to seal it is going to be no stretch. Okay, so now her tape is on that side, and I'm going to do the same thing over here. I'm not touching the tapes. I'm going to roll that tape until it's sealed, letting it go, and there we have it. So her tape is on. That tape is going to take about an hour. It's going to adhere to the skin, and it's staying on until you take it off. So the next taping that we're going to do, and sometimes these tapes can be a little tricky, so I typically will just pull a little piece of that paper off. And now, again, I'm not touching the tapes. I'm going to try to stay away from them. And I'm going to set this right next to her spine on the left-hand side. And I'm going to put it a little bit of an angle because I want to go up over her scapula. Okay, now in order for me to do this, she's going to go ahead and she's going to put her arm on the stretch, so she's stretching that scapula out nicely. Okay, so now I'm going to put some stretch on that tape. I'm going to run my fingers right up along it. I'm going to go right over that other tape. Now I'm going to have her come back to a nice rested state with her arm, and I'm going to take that tape right over the shoulder. No stretch. Okay, so that's a nice taping right there. So that's on, and then we're going to do the same thing to the other side. This tape is going to stay on for 3 to 4 days. Its life expectancy, really helping her out, is 3 to 4 days. So on the 4th day, she usually will just take it off. Okay, and here we go again with this tape. And again, no stretch where you attach it. You just tamp it down. And now it's stuck. I'm going to pull that tape right out. And now she's going to bring her arm up in front and across her midline. And I'm going to run my fingers along this tape because I don't want it to wrinkle. I want this tape to stay nice and flat. And now she's going to bring her arm back to its rested state. And there you have it, nice tape job. She's going to stay. So what this is going to do, it's going to take her shoulders and it's going to pull them back and it's going to pull them down. And she'll be staying nice and comfortable for the next couple of days. These tapes you don't even feel. They're really, really comfy. And that is a back taping.